Centre warns 4 states including Kerala to maintain strict vigil as COVID cases rise. The news in detail. The Union Health Secretary wrote to the Maharashtra, Kerala, Chhattisgarh and Bengal governments on Thursday to underline the need for strict vigil and prompt action to arrest the recent spike in coronavirus cases in each of the states. These 4 states account for 59% of all active COVID cases in the country, the Health Secretary Rajesh Bhushan said in his letter. The state governments were also warned against allowing testing rates to drop, particularly in light of the spread of a mutated and considerably more infectious strain of the virus, and to aggressively implement the test, track, treat strategy deployed by other states. Mr. Bhushan also reminded state authorities to urge people to wear face masks, maintain social distancing and follow all other COVID-appropriate behavior. The letter comes after Health Minister Dr. Harsh Vardhan singled out 3 of the above 4 states, Kerala, Chhattisgarh and Maharashtra, and said a surge in cases served as a warning that the war against the novel coronavirus is far from over despite the presence of multiple vaccines. Meanwhile, the Union Health Ministry has informed all states and union territories that the first supply of COVID-19 vaccine will be dispatched shortly. On Friday, the second phase of nationwide vaccine dry run will be taken up by all states and union territories except Uttar Pradesh, Haryana and Arunachal Pradesh, as they have already conducted dry run in all the districts. States like Andhra Pradesh, Assam, Bihar, Chhattisgarh, Delhi, Gujarat, Haryana, Jharkhand, Karnataka, Kerala, Madhya Pradesh, Maharashtra, Odisha, Punjab, Rajasthan, Tamil Nadu, Telangana, Uttar Pradesh and West Bengal will receive their supply of vaccines by suppliers. While other 18 states and union territories, Andaman and the Nicobar Islands, Arunachal Pradesh, Chandigarh, Daman, Nagar Haveli, Daman and Diu, Goa, Himachal Pradesh, Jammu and Kashmir, Ladakh, Lakshadweep, Manipur, Meghalaya, Mizoram, Nagaland, Puducherry, Sikkim, Tripura and Uttarakhand will receive their vaccines from their respective government medical store depots. Though preparation is on for rolling out the vaccination drive, COVID-19 cases in Maharashtra, Kerala, Chhattisgarh are worrying, the health minister said. The ministry on Thursday wrote to these 3 states and West Bengal to check the sudden spike in the number of COVID-19 cases in these states. Interacting with the state health ministers regarding the dry run, Harsh Vardhan asked them to submit their inputs after the dry run gets completed. Kerala Health Minister K.K. Shailaja raised the issue whether doctors who are practicing only in private will be registered for first phase vaccination. And also there's a confusion over the cost of the immunization drive as well. While priority groups will get the vaccine free, the centre has not yet spelled out whether the state governments will have to pay for the doses. Like the last round of dry run held on January 2nd, the districts will identify 3 types of sessions for the mock drive: district hospital, medical college or private health facility, urban or rural outreach. The steps of a dry run include beneficiary registration, micro-planning, vaccination, and the union minister emphasized that the site organizers will have to hold review meetings after the session to gather feedback. There will be 4 types of officers deployed at a site. Vaccinator officers include doctors, staff nurses, pharmacists who are legally authorized to give injections. Then there will be vaccine officer 1 including police, home guard, civil defense, NCC, NSS to check the registration status of a beneficiary. Then there will be vaccine officer 2 who will verify documents. Vaccine officers 3 and 4 will manage the crowd. News Desk, Karma News.